I'm Andy Munce. I'm the president and CEO of Sanford Health for our Sioux Falls market. I was a jackrabbit and received a bachelor's in nursing, and I also have a master's in nursing. When I say Sioux Falls market, it's Sioux Falls really metro, but then it's also all of our facilities from Aberdeen to Chamberlain to Worthington, Minnesota, and even some Northwest Iowa. So really involved in that wide swath of clinics and hospitals. I work with, how are we doing from a patient access standpoint? What does that look like from services that we provide? One of our missions at Sanford Health is to provide care close to home. So what specialties are we able to outreach to, say, some of our network locations, which would be outside of Sioux Falls? What services are we providing even within Sioux Falls that we could enhance? All the way then to also not only taking care of our patients, but taking care of our teammates and our employees, because that's a big portion of how we provide great patient care. We can't do it without our employees. So how do we hear from our employees? How do we engage them? How do we work with them to make Sanford a great place to work? I've been at Sanford my entire career. Honestly, I've been through almost every position here within our Sanford Health market, from a frontline nurse to a nurse manager to a department director. I was our chief nurse within our Sioux Falls market for a period of years, and then right when COVID came, I functioned as our chief operating officer. I decided to go to SDSU because I knew I wanted to do a career in healthcare. Got admitted to the nursing program, went through that process, enjoyed all my clinicals, and I feel like the skills that I learned at South Dakota State University really set me up to be successful in my career after, and allowed me and enabled me to get those life skills really early on in the process, and I feel like it really benefited me. Obviously, if you would have asked me 20, 25 years ago if I'd be in the position I'm in now, I would say I would never have thought that. Having a clinical background, though, as a leader within a health system is very beneficial. And so it's having that clinical background, but then also you need to couple that with relationship skills that you learn throughout your college experience, throughout your professional education. And it's really the combination of those that I believe make you successful and that I'm most grateful for. That whole experience up at South Dakota State University really set me up to be successful.